Hey, what is up? It's me, Banner Drops, and yeah, I'm just playing. I'm gonna stay home. This is my cow, as you know, with the door open. 9 gold. Do I have any apples? Because then I can make a golden apple. I shouldn't chant this thing, but if I make a golden sword, I got 9 end pearls, so I won't sleep tonight and I'll kill a bunch of them. But also I need to make a map, so I will take this paper. Anyway, so my plan for this was basically just to, what the hell's the map? Sorry, paper, yeah, cool. I'm just trying, cartography tape, I do need that. Need to make a map first. Book. I cannot find map. I just go search, and I don't remember how to search map. I do not remember how to make a map. I think I know, but not sure. Something like this. Oh, if I can, I need to make a compass, don't I? Where's my redstone? I do not have redstone. Alright, map. Oh, I want to make a map. Okay, if I can't make a map, I will probably need to use this cartography table. I'll put this.
Right, then?
Yeah.
Okay, you come off of there right now and you sort this.
Okay.
But the first thing you need to do is listen. Right, this is just you that can hear this, yeah?
2 weeks ago, and we're getting full.
Yeah.
So people getting infected now, who will be treated in 2 domains.
How do I get it back?
People I saw. Speak to Jack. Jack, good evening to you. Hi. Tell me about what's been going on. I'm an intensive care consultant. I'm on call.
This is in the UK.
I can't tell you where I am. But we are very busy and we're filling up. And I've just taken a little break and I thought I'd listen. I've been listening throughout the day and meaning to phone because it is beyond me why people don't see what they are creating by just continuing to go out. We're treating the people who got infected 2 weeks ago, and we're getting full. So people getting infected now, who will be treated in 2 weeks' time, I don't know what's going to happen.
That's
listen.
Today, I can't remember whose show it was. Anyway, I thought I'd get in pretty quickly because there'd be nobody on the streets, but it took me longer to get to work than normal. And I was just amazed at the number of people I saw on the roads, on the streets, walking, going in and out of shops, which is fair enough to go buy food. And then I think she said that she had heard that on her tweets that people who are not working and are working from home are going into the bars, and that's what happened in Italy. And the only way this virus stops is if we stop touching each other. If we go to keep 2 meters away from each other, we don't wash our hands and just not touch anybody. And it may not be you that gets it, but for every one person that gets it off you, by the time 10 people have got it, and it's passed through 10 lots of infection, we're up to tens of thousands of people who will have this virus, of which 10% will come into hospital, of which 4% will come into ICUs. You don't need to get a statistician. Yeah, completely. We're already filling up. Full. We're expanding.
That's not good.
This is serious. I don't quite get, why a government has to tell you don't go to a pub. You know, if you go to a pub, somebody who gets the infection that you may have, it may not be the person you touch, but within 10 people, there'll be people who'll be dead. That's basically the way this thing works. And I think anyone who goes for a Mother's Day thing to somebody's pub, you know, it's beyond immoral. You know, this will not stop unless we stop going out.
I do understand that it is bad.
You sound, Jack, not just
He sounds really worn out,
I'm guessing,
tired,
does he have it?
knackered. No, he's looking, not yet. He's likely to get it because of his job.
He's working
He's working to save people's lives
from it.
from it. So at the hospital at the moment, they have multiple operating theatres. Yes, they've got a lot of operating theatres. I don't know how many, but say 20. They are closing most of the operating theatres so that they can... See, look how I've automatically, as you come closer, I've walked away from you. This is how serious it is. Even in our own house, we need to be a bit apart from each other. Because if I've got it, I don't want you to have it. And vice versa. If you've got it, I don't want it. So we just have to be apart. At the moment, in the hospital that I work at, they've cleared 2 wards. They've emptied them. People who would normally be in hospital but could probably just about manage at home, they've sent home, and they've emptied a ward. They've emptied a whole ward for coronavirus patients. Also, all of the
really
operating theatres at the moment, the ones that... So Auntie Lynn next week is supposed to have an operation on her knee because her knee doesn't work properly, so she needs a new knee. So it's really bad. She can't walk very well at all. They've cancelled her operation. Her theatre is being turned into an intensive care unit. Because theatres are set up to work as intensive care units. Because if you think about what you need in a theatre, you need oxygen, you need masks, you need stuff to help people breathe. And what do you need in an intensive care unit? All of that.
Yeah.
So all the operating theatres are being turned into intensive care units.
This really isn't good.
This is kind of like a zombie apocalypse without the zombies. It is the beginning of that. This is
Black
where
Summer for Z Nation.
Absolutely, and this is what it is. It's the beginning of that. Without the zombie, just got death. The military, the army, people in the army are being briefed at the moment because we are looking at heading so that we have to have a complete lockdown. We won't be able to go out for any reason whatsoever. I would have to go out to go to work. I would have a permit which would allow me to go to work and to come home again. That's it. Same with Daddy. Possibly. They might cancel Daddy's jobs.
Why would Daddy have one? Because
it's work. Because the society needs money to function. We live in a society that we need money for education. Schools need money. And even if you're not going to school, the teachers need to be paid to keep their mortgage, their houses, to buy food for themselves. So we need to function as a society. So they want to keep jobs where they can. But where it's a risk...
And you don't really need it if you're properly thinking about it. They're shutting it down.
They're shutting it down.
Yeah, I'm really gonna...
So your hygiene, you need to wash like that.
I do it 4 times.
Like that.
Cause
this is how you wash. Lots of froth. So you need water as well as soap and air, because that makes the froth. So that way, side on each hand, the back on each hand, between your knuckles on each hand, and then your fingers on each hand. Finally, all around your thumb. And then if you can, not every time because it's not practical while you wear sleeves, but at least twice a day, preferably more if you can, you pull your sleeves up and you go around your wrists.
Okay.
Yeah? But it's not practical to do that every time. But as long as you do really good hand washing, always wash before you put your hands in your mouth and eat.
I will.
Always wash before you handle dishes that we're going to eat from.
Always wash.
Keep your phone clean 2 or 3 times a day and put it down and wash your hands before you empty dishwashers. Anything that's going to go, that you're going to eat from, needs to be kept as clean as possible. This room This is where you
clean.
stop.
I'll clean.
So we need your dirty washing to go out there. We're going to start doing some washing today.
Yeah, I will clean.
All rubbish
this.
needs to go. Put some traces on first of all.
Okay.
All your rubbish needs to go in the bin bags. There's a bin bag just outside the front door. So pick up any fallen rubbish out of it and put your rubbish in it. Yeah.
Okay.
Really super important that you take this seriously.
I will.
Clean your door with a wipe.
I will take this seriously.
Yeah.
I just want to say something.
I know I'm going on and on and
yeah,
on. But
I am taking this seriously.
Okay, I'm frightened. I went to Granny's house on Friday, Thursday, because she wanted to give me a birthday card. We stood about this far apart. We went like this, we exchanged cards, and then we stood back and we talked and we faced different directions, so we're blowing air in different directions. That's how serious it is. Because somebody granddad's age could die from it. Nanny is driving us nuts because Nanny is refusing to change her lifestyle. Nanny keeps going out.
That's not good.
No, well, you don't understand what it's like. I live here on my own. I said to her, well, how much longer do you want to live there on your own? You need to take this seriously. I'm not dicking around here. You need to take this seriously. At the hospital, they're frightened. Where I work, they're frightened. They are probably cancer patients. They're stopping some of them having treatment. Where people have got a chance of living for years, they're giving them a great big break, 2 or 3 months before they give them treatment. So all that time the cancer's growing in their system. It's growing slowly. So the doctors are having to make horrible, horrible decisions. Do we give you chemotherapy, which is a side effect, wipes out your immune system, or do we let the cancer grow slowly because we know then you've got a chance of fighting this virus?
Yeah.
This is a scary choice. So my patients yesterday, I was supposed to have 21 or 2 patients. I had 13. They cancelled the rest. You can't have people where they have a normal course of treatment, where they have 6 treatments, which is a normal course over 6 months. They're locking that down to 4 months, 4 treatments treatment. That will do for now. We're not going to give the ones that just make sure, because that will do.
I do I just want to say something. When I get annoyed, it's more because I understand how bad this virus is, but I'm doing the stuff you tell me to. I'm doing happy birthday
Your
twice.
problem is you moan every time I check, and I know your hygiene is not great, and I am grateful for the things that you are doing. But like I looked in the fridge yesterday, and masses of milk has gone. I don't know. So the co-op is opening less hours now. You cannot buy things like milk and bread and stuff anywhere. Luro. It's just, you can't buy it. People are greedily buying loads and loads. Yeah? So what I've got in that fridge, that's it. Who knows when I can get some more? You have to make it last. What's the point of having a bowl which is absolutely full of milk one day when you can have a bit less milk and you can have it for 3 days?
Yeah, I get what you mean.
You know, it's just about being sensible. That is why every one of our cupboards is full of a variety of things. If you look in the cupboard, there's not lots of doubling up, because I'm trying very hard to let there be stuff for other people, and I've bought it over a period of days. So we now have enough food to last us for maybe a month. It will be longer. We've got food that will last longer, but we'll be eating crappy stuff we don't even want to eat at that point.
Yeah.
Yeah, but about a month of decent foods. We don't need to go out now. Daddy and I are going to Exmouth on Monday. You are to stay inside and do some schoolwork.
And I will be doing that schoolwork. Anyway, I'll do my
really
room now.
important that you do panic a little bit. You treat it, you can't have sleepovers. Who knows when you're going to be able to go back to school. That's how serious it is. They have closed the school and they have not released a renewal date. You may not be going back until for 6 months. But it's not just not going to school for 6 months. You can't have sleepovers.
Can't visit my friends.
You can't visit your friends.
I understand. I do properly understand.
You will go nuts. You'll be horrible. This is why we want to encourage you to create an online forum, so that you can have like a bit of
I do. I've got a
If you
group
know
that I'm
how,
all in.
yeah, a group that you can chat to, not
Yeah.
just play on your game,
No, look.
but have a proper chat.
Here, let me show
But
you.
no, but I mean visually, so that you see them, like Skype, that kind of thing.
Yeah, we do. We use the group for. Sorry, I was watching Hotel Transylvania. Pause. We do have a group. When we can't
Good.
video call, we text. Look,
That's
I'll
good.
show you.
Pretty soon they're not going to even let you go for a walk around the village. At the moment they're requesting that you don't, but it's a request at the moment. Pretty soon it will be insisted. Yeah?
Yeah.
So we need to take it seriously. We need to try and keep as safe as we can.
Yeah, look. We do.
Yeah, that's just photos. I mean, so that you
No,
can all see
like
each other and
we
chat.
normally what we
But
do.
you want to
is-
be in a nicer environment. So the other thing is, at the point at which Daddy is locked down and can't go to work,
Mhm.
we could decorate your room. Yeah? Can't put new flooring in because we won't be able to get any. But we could change everything else. We've got enough paint that we could paint it the same colour as Thomas's.
Mhm.
Clear it up. We could make a really nice job of it. We could decorate out there. You know, we could make some fun. We could make our garden really nice. I bought some seeds. I'd like to get a
Oh,
bit
yeah,
of
I'd
garden
like
so
to-
we get some.
I'd like to just have one seed in a particular area that I can only I nurture it and see how well I can do.
Well, we'll see. But we're going to do all these things. But we need you to be on board.
Okay. Can I please finish what I'm doing?
It's 25 to 12, but order 2, I want you to put it.
Okay. I'll put Hotel Transylvania back on.